All right, welcome back, everyone. Today we are finishing up with chapter 22, and after today, you will have gone through the entire book. Well, that is if you've watched all the videos and/or actually read the book. But judging by the amount of views I get on these, I highly doubt anyone has actually read the book or viewed all the videos for that matter. But anyways, let's finish up here. We got the head, face, eyes, ears, nose, and throat. Now, most all of this is going to end up being because, or all these injuries are going to be because of mostly from trauma or blunt force. So I'm going to go through these pretty quickly here. Not so much I'm going to go over with the anatomy, but let's jump right into our bony injuries. First one here is a skull fracture. Very, very difficult to do unless you really get hit. So this here is your example of your skull fracture. If you notice all these lines here that are squiggly, so these are squiggly lines. This is like a straight line, squiggly line, squiggly line. Those squiggly lines are actually joints in your skull. So your skull is a series of joints that come together that are virtually immovable. So your skull, or the sutures in your skull is how they're referred to, are your most stable joints you have in your body. But if you fracture your skull, you have been hit very, very hard, or you have fallen on your head. Orbital fracture or nasal fracture. If you have an orbital fracture, you're getting punched in the orbital bone, which is just underneath your eye, and that would break there, potentially causing problems with your sinus cavity. A nasal fracture, pretty self-explanatory. You have been hit in the nose. Again, these are not going to really happen to you unless you are struck in the face. Jaw fracture or dental injury, again, you're going to get hit in the face if this happens. If you have a dental injury, usually there's no real big concern with that other than making sure like you stay within your pain tolerance. If you have a jaw fracture, you actually have to go and get your jaw wired shut so that can heal. Because if you're allowed to keep moving your jaw, then that's never going to heal and it's going to hurt very bad. So usually for about 6 months or so, you have to drink through a straw for all of your meals. Lacerations. Now, these are going to be any kind of cut you have. They can be as benign as getting like a scratch on your cheek, or as terrible as you see with either of these, with getting like your lip gouged or your huge head slice there. But these are only as serious as the depth and location of them. If you were to lacerate an artery, if you go deep within your face, that could be bad. If you were to lacerate, say, like a nerve, or especially like around your jaw, that could potentially cause you to not be able to chew or swallow. So the only real issues here is if you have a really severe cut. And again, that's usually not going to happen in most sports. Really, if you were to get cut in the face, most likely would happen like, say, in hockey, like ice hockey. But again, that's really, really rare for that to happen still. Now, other things can go wrong. Epistaxis. Epistaxis is a nosebleed. So when your nose bleeds, that is what's called epistaxis. If you look at this here, part B, this will show you some pretty good anatomy of your nose or internal nose. So you would be looking straight back through your nose. And this would actually be an example of it would be your left nostril, but we're looking at it from the front, so everything's on the right. So when you think about this, your nose looks like this, kind of. I hope that doesn't look too terrible of an image. So this is all occurring on the outside part of your nose. So this is occurring really up in here inside the nose. You'll see here that you have this opening. That is to get into your sinus, so your sinus right underneath your eyes there. So that'll drain into your nasal cavity where you get like snot, things like that. Anytime you see the word foramen, that means a hole. That's all a foramen is, it's a hole. Now, what's really important here is this thing right here. This is your inferior turbinate. You have 3 turbinates in your nose, and they're way back past what you can pick. So you can't usually feel those unless you really get deep in there. I'm talking like, 2, 3 knucks deep. Anyway, your inferior turbinate is what goes wrong, or this is the thing that causes you to ever get a stuffy nose. If you get a stuffy nose, and it can be from a number of reasons, the inferior turbinate swells up. It swells up and it cuts off your breathing. So if you notice here, this goes back deeper into your nose. That's your airway. If your turbinate swells up, it can cut off your airway so you can barely get anything in there. Typically, you'll only have one or the other inflamed at once. So usually your body does a pretty good job to make sure one nostril stays open while the other is swollen shut, kind of thing. But again, epistaxis, nosebleed there. All right, now this gets into the major topic I want to talk about here, which is concussions. Now, concussions are a big issue, especially in football or any other contact sport where you're going to be subjective to being hit or have a lot of upper body contact. Now, when you have a concussion, what happens is you have a force that causes your neck and head to move either back or forward. This is independent of having something like whiplash or having any other muscular injury. But what happens when you get a concussion is your brain hits against the skull or the walls of your skull. Your brain isn't packed tightly against the skull. There's actually a good layer of stuff. Typically, it's like you're looking at like water type, really like a water type insulator around there. But this allows your brain to move a little bit so that if you, like, say, bump your head, you don't strike straight on your brain, or if you twist around, like move your head, that your brain doesn't essentially get squashed against that. It has places to move. So when you have a concussion, your brain violently hits the skull, typically causing it to have a contusion. So you essentially get a bruise on your brain. So what happens is you have blood vessels that break open. Now, it's not going to be, or it shouldn't be, in the same amount of severity that you would have, like, say, a stroke. So a stroke typically happens deep within your brain. A contusion is going to happen more superficial, so on the outside of your brain. And you would have a stroke in an area called the circle of Willis, but that's neither here nor there. What happens when you get a concussion is immediately the area that's hit or the area that's affected, you get what's known as an energy crisis. Because blood flow is going to be temporarily shot down, your body has a higher demand for glucose. You need to have glucose because glucose is the only thing that's going to power your brain. If you don't have glucose, your brain's not going to run effectively. So blood flow decreases, the need for glucose increases, and then your oxygen metabolism is going to decrease. So what this all means is that you have a decrease in the function of your brain because you don't have enough energy and you don't have the ability to produce enough energy when this happens. So that's primarily why you would get like say confusion, or you could potentially like have vomiting. You can black out, pass out, that kind of thing. That's all as a direct result of this energy crisis that happens in your actual brain. This usually will wear off within roughly a week, but you can have, and when you have concussion symptoms, it typically is cognitive related. So you would have issues with cognition, or like learning or being able to express yourself, things like that, if in the days following the actual concussion. This doesn't count like say having like a headache, which definitely can also happen, ringing in your ears, but all those are your stereotypical examples of what's going to happen after you have a concussion. Now, when you have a concussion grade, um, in any football now, any suspected concussion means that you should not be playing the rest of that game. So especially with like the NFL now, they're taking a hard stance on this, hopefully, which means if you get a concussion, you should be out of the game. You have to go through a concussion protocol. Now, this Colorado Medical Society have listed guidelines for return to play, and essentially what they would do was spread the concussion grades into 3 categories and split group 3 into 2 subcategories. They've kind of gotten away from that because now if you're unconscious from a concussion, they've essentially grouped that all together. Typically, if a concussion knocks you out, usually you're talking about the need to be off the field for roughly 6 months to a year. So returning to play in the immediate short term only applies to grades 1 and 2. If you have a grade 1 concussion, usually you're going to be able to get back into play relatively quickly. You're usually not showing signs of any concussion or any issue with that concussion there. Grade 2 concussion would essentially be that you are staying conscious, but you are very discombobulated. So if you had a grade 1 concussion, you essentially got hit in the head pretty hard, but you didn't lose consciousness, you didn't lose any cognition. So you still have your wits about you. If you don't have your wits about you, that's when you're looking at a grade 2 concussion. Now, one of the things we have here is a problem with our helmets. What a helmet does is it's supposed to, protect your head, obviously, but if you're wearing a helmet and you get hit in the head, the helmet does a good job with dissipating some of that energy, but doesn't fundamentally stop your head from moving. So the only real way a helmet's going to completely absolve you from a concussion is if it were to be able to completely dissolve or dissipate that energy or the force you got hit with. When you look at something like this is a newer model of a pro football helmet. This would be if this weren't painted at all, if it were just clear. And what you see here is you see all these knobs here. And all these act as different places to let the helmet collapse, because if the helmet's allowed to collapse in, it absorbs more of the energy or more of the force and allows it to dissipate better than if it stayed rigid, which would just essentially let the force go straight through to the other side. This slat you see here is an air release. So with these, you may see people getting their helmets pumped up with air, and it's all to allow this cushion to happen. So you pump that helmet up with air, and then if you hit the ground, that flap will pop open and air will come out, allowing the helmet to absorb again more of that energy. If that happens, so once you get hit and the air releases, you have to replace that with more air. They're not foolproof, but they are much better in allowing your helmet to absorb more of the force than previously what it was. Now, if you get post-concussion syndrome, this is where you get concussion symptoms even after the injury has healed itself. So if the injury was completely gone in terms of, your body is healed, you've gotten like an MRI or CT scan, shows no traces of any injury, but you still have symptoms. Typically those symptoms are going to be headaches. Other times it can be like nausea, dizziness, blurred vision, but that is all suggesting you have post-concussion syndrome, where you're still having symptoms after the concussion is actually resolved. Another one to note is this second impact syndrome. Second impact syndrome really just means you have gotten another concussion. So you've gotten a second concussion before the first one heals. This is where you have real big problems, because now you can potentially cause swelling on your brain, which causes your brain to die or have like a massive stroke. This is really where the problem lies with people coming back too early from a concussion, is if you get second impact syndrome. That means getting a second concussion before the first one heals, then you have the potential to actually die from that. The major problem with a single concussion is the brain swelling. If the brain swells too much against your head, there's no place for it to go. If I say, get a major hit on, like, say, my forearm, where I have a lot of inflammation, my forearm swells up, well, it's just soft tissue there. It's skin. Skin can move to the side. Your skull can't move. So if your brain swells against your skull, it can actually kill your brain. That's why if you do have a suspected concussion, it is a medical emergency. You do need to go typically to the hospital for that, because in a worst case, if your brain swells and cuts off blood supply, you need to actually get a piece of your skull cut out to allow your brain to swell so that it doesn't cut off that blood supply. Now, CTE, this is chronic traumatic encephalopathy. You hear this a lot of times with NFL players that have had multiple concussions later in life. Usually what's happening here is that you get a lot of concussions or a lot of subconcussive impacts. So if you have a lot of concussions, it can essentially degenerate your brain. Now, the only way to diagnose this is post-mortem, meaning the only way you can actually diagnose CTE is if you take someone's brain out of their head. So you only do that when you do an autopsy. You can't diagnose this when somebody is living. If you notice, though, what's happening here in CTE, you have a lot of loss of white matter here, and really overall loss of gray matter as well. So your brain loses size, and when that happens, the function of it really diminishes. So you essentially get symptoms of dementia or Alzheimer's when you otherwise shouldn't. Now, if you have a subconcussive impact, that means that you've been hit on the head with a force that is less than what a concussion would require. This doesn't do anything to you immediately. So like if you're a football lineman, virtually every single play you're involved in, you're going to get a subconcussive impact. If someone just hits your head, like if I just hit my head like this is a subconcussive impact. It's not enough to give me a concussion. It's not going to hurt me right now. But over time, we're finding that the long-term effects of these, and by we, I mean researchers in this field, that long-term subconcussive impacts can be just as bad as people who have multiple concussions. So it looks like that all of the impact you have against your head adds up in the aggregate long-term. The best thing to do is to not get hit in the head. So don't play football, but At the same time, if you are going to play football, the best thing to do is to make sure you have the best equipment, best safety equipment you can have, meaning the best helmet you can have, and also that you are fundamentally knowing your body and not trying to come back from a concussion before your body is ready to. Last couple things here I want to finish up with. So with the ears, there's a couple things with the ears that can happen. So inside the ear, you can have an eardrum rupture. That's your tympanic membrane. So that's your eardrum. If you have an eardrum rupture, it just means that this has torn open. That'll heal on its own, but it does cause pain. You can potentially get middle ear infections. Swimmer's ear, or otitis externa, is this here. That's where you just get an infection in the ear canal. Pretty simple. It'll clear itself up with usually some ear drops. It happens a lot to swimmers, so prolonged exposure to water will potentially lead to bacteria getting in there. And then earwax buildup is just where you have a clogged ear from earwax. Usually earwax will just flow out. So if it gets impacted, what happens is you've either, say, used a Q-tip to push it in there. So using a Q-tip will actually cause impacted earwax because you don't allow that earwax to flow out. You go in and you actually push it back in there. Or one of the other things that can happen is if you ever go to your, barber, stylist, whatever, and they trim any of the hairs inside your ear canal, that can actually get lodged down in your ear canal, causing that to happen. So if you actually get any hairs, like loose hairs in your ear canal, that's pretty much a guarantee that you're going to get impacted earwax or an earwax buildup. With your eye, conjunctivitis, that's just pink eye. So that's just an infection of the eye, or a bacterial infection of the eye. No real big issue, but it is, something that's very contagious. Happens a lot more in like kids and especially people at like daycare than it would, in the general population. Now, corneal abrasions, this can happen to virtually anyone. A corneal abrasion means you have a scratched cornea. This is diagnosed under UV light. So if you put your eye under UV light, which is what this is, you could see here, this is scratched. I've actually had this happen to me before, but pretty much when it happened to me, I could barely open that eye. So like the eye, I had a very hard time opening it. It was really, really sensitive. I got poked in the eye is what happened. And the fingernail of whomever the kid was, I forget who it even was, but it was back in like 7th, 8th grade, something like that, scratched my cornea. And that is actually a very common injury to have in basketball. This happens quite often in basketball. So a lot of times wearing protective gear, even wearing eye guards, like eye goggles, can actually be really beneficial to help you there. Contacts can offer a little bit of support or a little bit of protection, but I wouldn't bet my life on them. Corneal abrasions are only bad if you don't allow them to heal or if you keep re-injuring it. Your eye is actually one of the fastest healing parts of your body, so you would actually get this to be healed in a day or two without really any other issue. And then last thing here is your external ear in your throat. So cauliflower ear looks like this or this. Very common in, like, say, boxing, mixed martial arts, any sort of combat sports. What happens here is when you get cauliflower ear, you've been punched in or struck in the ear. And what happens is that you get blood vessels in your ear that rupture. And that's why you see the swelling of the ear happen. The problem is, if you don't get this drained immediately, that blood gets caught in there and then scar tissue forms around it. So if you don't get, and what they have to do is they have to cut that open. So you'd actually slice this open and all the blood would drain out. But if you don't do that immediately, like within that day, you're going to see that the ear actually starts to solidify because scar tissue builds up in there. Once you pass roughly a day of having this, it's permanent. You can't go and get that fixed, because now underneath that is all scar tissue, and you really can't go and resect that. So that would be kind of the ear you'd be stuck with. And then throat punch, just wanted to throw that in there, get hit in the throat. The big thing to worry about there, aside from pain, is if you were to rupture your windpipe, or if you were to tear your windpipe. If that happens, you potentially could die of asphyxiation because you may not be able to breathe. It's kind of like if you try to drink through a straw, but there's a hole in the straw. It makes it very difficult to actually drink from that because the suction from the straw doesn't stay where it should be. But with that in mind, that is everything here to finish up with our head, face, neck, ear, and throat. So that is everything for the full semester. I hope everyone found this at least a little bit helpful for you. And it has been an absolute pleasure to be working with all of you. And I hope to see you all here in the future. And until then, have a good rest of your day, and I will see you all here soon.